Let us speak about the COVID situation in India in recent times. As all of you would know, there's been a massive uptick in cases of COVID-19 in India in recent times. Since April 15th, 2020, you can find that more than 200,000 cases per day. And on the 26th, there were more than 350,000 cases, as shown in the graph. Now, some time ago, last year, you found when you took the 10 countries that had high levels of COVID, you found 8 of those countries had a second peak. And India and Argentina did not have a second peak. And at that time, there was complacency, and a lot of the steps that should have been in place were not taken and carried out. And this led to a massive uptick in cases from March, and you can see the number of deaths per day that has also showed a rapid increase. This has been all around India, specifically in Maharashtra, including Bombay, Delhi, and several other regions of India where the number of cases has increased. And this shows you that this graph shows that India overtakes Brazil as being the number 2 destination or location where the COVID cases are highest, behind America, US, which leads the way. And the important thing to remember from this graph is during the first peak, the rate of rise is very much lower than that in the second peak, as shown in the figure. Increasing from 1 lakh cases to 2 lakh cases, 100,000, 200,000, took 21 days in the US in October. However, it took 10 days in India, so there has been a rapid rise of the number of cases in recent times. Why did the cases increase? For 2 reasons: relaxation of social distancing measures, election rallies in Kerala, Tamil Nadu, where even very important politicians were still campaigning in March, on the 30th of March, religious festivals, reopening of public spaces, and the place of viral variants. In certain places, the UK variant had become the dominant strain, and the development of the new Indian variant or double variant, which will be discussed later. If you look at this, you can see that the number of places that there were election rallies in March and going towards April, and in the state that there was election with no social distancing and some religious festivals, the number of cases rapidly increased, as shown in this figure. This has led to inefficient and insufficient hospital beds, diagnostic tests, medicines, medical equipment, oxygen. And we know the situation where many people have been turned away from hospitals. They have to find their own oxygen. We have to wait, relatives have to wait to cremate their loved one. And we already knew that India had a fragile health system with weak surveillance. And this process has really ended in an Indian COVID catastrophe. What needs to be done immediately? We have to decrease the pressure on the health system. The country has to decrease. Oxygen supplies have to be released to the different places where oxygen from one state should be allowed to go to another state without there being any restrictions. Ramp up vaccination programs should be in place where the numbers of our vaccinated should be increased. Strengthening social distancing measures and reintroduce lockdown measures, as has happened in Delhi, where it was there for 1 week and then it was extended. Now, other countries have come in with providing medical supplies, such as the UK, US, Germany, and China. Number of oxygen concentrators, etc., have been provided, ventilators. And the important aspect that has to be worked is that there were lots of export restrictions in the agents for the vaccine factories, and that has to be released by the US authority, and genomic sequencing tools should be strengthened and the technology should be available more widespread. Now, if you look at Serum Institute of India, they were providing vaccines for India and through the WHO COVAX program, where they were to provide vaccines for many countries in Asia and Africa. And so many countries around the world depended on this process to get their vaccines. However, with the present catastrophe that is occurring, the number of vaccines that has been released to COVAX Asia and Africa has been only 1.2 million in April, while it was about 64 million in the first 3 months of the year. So it is having a major impact in the COVID picture around the world. And in India too, the number of cases are increasing, but the vaccination outlay has been only about 8% of the population have been vaccinated. You can see the difference in the curves regarding vaccination and the number of cases, and this has to be ramped up quickly. So this is another schematic representation of the problem that COVAX is facing, the WHO Gavi consortium, because they were promised a certain amount of vaccines, but that amount of vaccines has reduced now as the vaccines have to be kept for use in India. And even in India, there's a plan to vaccinate up to 300 million people by the end of July, and still the vaccine rollout has been slower than what would be more optimal. So this comes back to the question of COVID vaccines in wealthy countries and WHO, with wealthy countries prioritizing vaccines for their own population and vaccinating people who are at lower risk than those in countries where the pandemic is really raging. While WHO is always pushing for global vaccine equality and for vaccines to be distributed with equity, so that with some level of equity, so that the pandemic would not go out of control. The global supply of vaccines are unlikely to pick up until the end of 2021. We know that. So therefore, international leadership is needed to ensure that the countries that need the vaccines are provided this. Because otherwise, unchecked transmission, like is happening in India, like what happened in South Africa and Brazil, in the UK and the US, would lead to increased risk of dangerous virus mutation, and this would in turn prolong the whole pandemic, and it will have an untoward effect on the global COVID pandemic across the world. Thank you.